In glaucoma care, every exam step matters. When IOP measurement interrupts the slit lamp flow, efficiency and the patient experience can suffer. The iCare ST500 changes that, bringing tonometry directly to your slit lamp workflow. Professor Luca Rossetti shares how this integration is reshaping routine exams in his clinic.
Imagine in a very crowded visiting room, you have hundreds of patients waiting there. You need to do a lot of measurements, and sometimes you're not so sure that results are so proper and accurate. Sometimes I have to redo tonometric assessment in order to be very sure that the pressure is that particular value. The rebound tonometry uses a probe, a very small probe, with a very small area contacting the ocular surface. That probably at the basis of the accuracy of that instrument. Well, major benefit is that I don't need to put anesthesia. I think it is very comfortable when the patients are not very good in opening the eyes wide, and that happens a lot, especially after surgery. The eyes are not wide open, and if you use applanation tonometry, then you have to help yourself with the fingers to keep the eye open. With rebound tonometry at the slit lamp, you can avoid this, and you don't run a very bad risk of infection. It's very important to have something that's perfectly new and perfectly clean, and this is very useful to have with such a device. I used rebound tonometry, but the handheld had a lot of experience with that. But patients and doctors sometimes prefer to have the instrument mounted directly on the slit lamp, because the patient is there, you take visual acuity, you look at this anterior and posterior segment, and then you get tonometry. And it's very comfortable to see and to have that all there. At the beginning, rebound tonometry was really complementary, because with the possibility with the handheld to move it, you got measurements in patients at the bed or in a wheelchair, for instance. But now having the possibility of using that tonometer on the slit lamp directly, that's gonna be a really good alternative. Not complementary anymore, but the first tonometer to be used by glaucoma specialists, but not just by glaucoma specialists. We have the possibility of using the faster mode, which takes 2 or 3 examinations, measurements, instead of the traditional 6. If you understand the quality of the measurement is good, then 3 very similar measurements means the real value is that one. And you gain seconds. I'm not saying that standard mode is not fast, but with the quick one is probably faster. I think that saving time is important. What are these 10, 30 seconds used for? They can be very useful to communicate, but you need time to explain everything to the patient. So if you are doing proper testing, proper examination with accurate results in a shorter time, we can use those seconds not only to do more examinations, but to make our examinations better and better. For instance, to talk to patients. Patients feel comfortable, so good also for them. The main advantage is you don't want to lose accuracy. If you find a value, that value is the result of an average of 6 different measurements, and you know that the final values, the average values, will be very accurate. This is very, very important.
In busy glaucoma clinics, accuracy and efficiency must go hand in hand. For Professor Rossetti, integrating tonometry with iCare's ST500 slit lamp tonometer improves both clinical flow and the patient experience. Learn more about the clinical use of the iCare ST500 and the evolving approaches to IOP monitoring by visiting the iCare website.